race. Mr. Chairman, Congress must act. I yield.
Will the gentlelady yield for just a moment?
My time is up, Mr. Rask.
Okay, thank you.
Thank you.
Chair now recognizes Ms. Norton from Washington, D.C. for 5 minutes.
Thank you, Mr. Chairman, for this important hearing. Dr. Gupta, I think you'd probably agree that the opioid epidemic is one of the greatest public health crises facing our nation today. Lack of access to treatment, and I'm interested in my questions on treatment, is a primary driver of this crisis. In 2021, 24 million people in the United States aged 12 years and older met the scientific criteria for having a substance use disorder, but the vast majority did not receive treatment. Dr. Gupta, are medications to treat opioid addiction effective?
Yes, Congressman.
And are most health insurance plans required by law to cover medications for substance abuse disorders?
Yes, they do, minus sometimes the games that get played about pre-authorization and other aspects of this that we are trying to address at this point.
That's important. There is no reason people should face continued barriers to treatment, but tragically they do. For example, a recent study indicates that Medicaid is one of the primary payers for medication that helps treat opioid addiction in the United States, also known as therapeutics. However, 50% of Medicaid enrollees with opioid use disorder still lack access to therapeutics. Dr. Gupta, based on your knowledge and expertise as a medical doctor, why is it important that people who experience opioid use disorder have access to medicines that help treat the disorder?
Thank you, Congresswoman. It is critical. We have less than 1 out of 10 people who need treatment today is getting treatment. It is worse for communities that are marginalized, communities of color, and rural populations. So it's important that when we look at telehealth, we look at being able to cover for these medications. There are 3 FDA-approved medications that people get the help when and where they need it. And that's exactly the work that this administration is trying to do, expand it to have the goal of universal access to treatment by 2025.
Thank you. Just last week, the Biden-Harris administration announced plans to distribute almost $48 million in grant funding for programs that expand access to medications for opioid use disorder. This was part of the administration's overdose prevention strategy and its coordinated whole-of-government approach to making opioid addiction treatment more accessible. So, Dr. Gupta, how would these grants help ensure people experiencing opioid use disorder have access to treatment, including therapeutics such as buprenorphine?
Thank you, Congresswoman. The fact is that today there's $24 billion more that are going into local communities than in the past 4 years. So for the reason for that, $83 billion in total is to get people the help where they need it and when they need it. These monies will help people access treatment. And one of the things that I will say is oftentimes people don't ask for treatment because of stigma. So it's important that we start to work to remove that stigma, whether we're working with employers, small businesses, or others. And that's an important piece of this work, to make sure that people can access it. They don't have the fear of being punished for that, and then treatments are available and accessible to them wherever they live.
Thank you. Dr. Gupta, how would reauthorizing the Office of National Drug Control Policy allow you to continue coordinating across government agencies so that people have access to opioid use disorder medications regardless of socioeconomic status or other barriers to care?
Congresswoman, what my office does is works across the $40+ billion budget across 19 federal agencies to coordinate the response to this. It's a congressionally created office. It is critical to saving lives that we make sure that treatment is available to anyone and everyone that needs it. It is an important tool in the toolbox to be able to help people save lives.
Substance use disorders are incredibly complex challenges that require multifaceted solutions. I look forward to continuing to work with the administration to get life-saving treatment into the hands of people struggling with opioid use disorder.
Would the gentlelady yield for a moment?
I yield.
Just a quick question on Ms. Fox's point. Does an increase in the amount of fentanyl seized indicate the failure of our drug strategy or the success of the policies of the administration?
Ranking member, it obviously, increased seizures means that more is being done at the border to hold people accountable. So it is an indication of the success of the policy and the strategy.
Thank you. Yield back.
Chair now recognizes Mr. Palmer from Alabama for 5 minutes.